come in.
Good morning, ma'am. Good morning, ma'am. I am Jessica Valdez from BSN 11, and I will be going to perform the written demonstration for the administration of sublingual medication. So the purpose of this procedure is to provide medication that has a systemic or local effect on the sublingual or SL route. So for our assessment, we need to assess for the following. First is the client's level of consciousness and ability to understand the instructions well. So how are you po?
Okay naman.
Ayan. So that's good to hear po, ma'am. Also, for the client's vital signs, so theoretically po, I've already got the respiratory rate, the blood pressure, the pulse rate, and the temperature of the client. So, it is all normal. So, if the patient also has a nausea or vomiting, ma'am, feel nyo po ba nasusuka po kayo ngayon?
Hindi naman po.
Okay po, that's good. So, also, the recent diagnostic or surgical procedures, nag-undergo po ba kayo ng operation po, gano'n?
Nan naman po.
Okay po. And then also, if the medication has an unpleasant odor, also the expiration date of the medication, and also, we need to check po muna natin. Ayan, so as I can see po, yung expiration date po ng ating medication is 2025 po, and there's no unpleasant odor po. And then, also for the history of the allergy to any medication po. Ma'am, may allergy po ba kayo sa mga gamot?
Wala po.
Okay po. And also for the color and appearance of our medication and the intactness of the wrapper. Yan. So, normal naman po yung color ng ating medication and intact naman po yung wrapper. And then for our planning, observe the 12 rights of medication and especially the 6 rights of giving medication, international standard, which is the right client, right medication, right time, right route, right dose, and right documentation. And then next is to do hand washing before and after the preparation of our materials. And then next is to prepare the following materials. First is the hypo tray with the lining, also our medication prescribed by the attending physician. Ayan, so I'm gonna check the label first. So, ascorbic acid, vitamin tablet, 250 grams po. And then also our medication class or cup po, and then our medication card. So, for our second checking, ascorbic acid, vitamin tablet, 250 grams, and then the route is sublingually. And the expiration date is on 2025. So next, for our implementation or procedure, don't forget to perform again a hand washing or hand hygiene. And then put on PPE if indicated. Next is to introduce yourself and verify the client's identity using 2 identifiers. So, ma'am, I am Jessica Valdez, your nurse for today. And may I know your name, ma'am, please?
Ruby Rose Emily Great.
Your birth date po?
January 27, 2007.
Okay, that's good po. So, ma'am, papainumin ko po kayo ng medication nyo sublingually, and I will be going to ask you to do some tasks for me. Please do follow my instructions well. Okay po, that's good. And then next is to explain the procedure. So, already explained the procedure po. Ilalagay po natin siya dito sa ilalim po ng tongue nyo, sublingual part po natin. And the right actions of the medication to the client and the relatives po. So, the rationale behind this is that this ensures that the right client receives the medication. And then place the hypo tray on the bedside table po. And then next is to provide for the client safety, comfort, and privacy. So, proper positioning po, either side lying or sitting position. And supine po. So, comfortable naman po kayo sa position niyo po. And then putting the side rails po downwards where you will work po. And then keep the other side rails upward po if theoretically we are in a clinical setting. And then next is to spread for the curtains Ayan. Spread for the curtains or close the door po before and after the procedure. And then next is to place the call light theoretically where the client can reach po. And then put down the side rails where you will work. And then assist the client in a comfortable position, which is the sitting position po. If not possible, on a side lying position po, to prevent the aspiration. And then unwrap the medication po. Unwrap the medication. And then ask the client to open his or her mouth po. Wait lang po. Ayan. So, ito na po yung ano natin, medicine natin. And then, open nyo na po yung mouth nyo. Raise nyo po yung tongue nyo, ma'am. Ayan. So, tilt lang po natin forward po to avoid the ayan po. And then, next is to hold in place po and tilt the head forward to avoid the swallowing of medication. And hold the sublingual medication under the tongue for at least 10 minutes po. Ayan po. Hintayin lang po natin matunaw po siya sa sublingual part niyo po. So, for at least 10 minutes po. So, after 10 minutes po, na-dissolve na po yung ating medication sublingually on the patient tongue po. Ayan po. And then, next po is to assist the patient in a comfortable position, sitting position po. Okay na po ba kayo sa position nyo? And then, keep the side rails upward po so that we can secure the safety of our patient. And then, dispose all used materials and then rearrange the reusable bowl. And then next po is to remove our PPE if used and perform hand guiding. Dispose na din po natin. And then assess for the effectiveness of the medication given. So after 30 minutes po, which is our time frame. And then document the administration done and the patient's response to the medication given. So, I gave the medication sublingually po. Ayan. So, okay naman po yung response ng ating patient. And then, lastly is to evaluate the patient's response to medication after a given or appropriate time frame. Ayan. Thank you po.